If a person has predominantly left-sided heart failure of any age and with many medical conditions which would eliminate transplant, they can still receive a left ventricular assist device, or LVAD, or VAD for short. These devices have come a long way since they were first used in the 1960s, and they enable a person to live a near normal life. All devices currently have percutaneous drive lines, or lines which come out of the body connected to the device, which enable us to control and monitor the device and hook up to battery power. A heart transplant, however, doesn't have a percutaneous drive line. A heart transplant is a total replacement of the heart with a donated heart from someone who is brain dead. This heart can function normally in the new recipient for 20 to 30 years. And without the limitations that ventricular assist devices have, most people, when given a choice, would rather have a heart transplant. However, there simply aren't enough donor hearts available in the United States currently to supply the need for all of these patients. For example, there are 300,000 patients with heart failure newly diagnosed every year. There are approximately 3,000 heart transplants a year. There are approximately 4,000 to 5,000 ventricular assist device patients every year. So if a person comes to me in urgent need and they have a choice of waiting, which they may not physically be able to do, or getting a VAD immediately, then VAD represents the best, closest therapy. And then they would go home and live their life, and perhaps in a certain percentage of patients, they would go on to receive transplant down the road. So a VAD can be, as we label it, a bridge to transplant. That is something which enables patients to go home and live their life, play golf, drive, go to dinner, and see their family, travel, and then when they're well, they receive a heart transplant. In the old days, when I had hair, we used to have patients wait in the hospital, and they were very, very ill, and a certain percentage of them would die, simply because we did not have the bridge to transplant VADs as we do today. And the patients who got transplants were very sick, they stayed in the hospital longer, and more of them 30 years ago died after the procedure than they do now.